एक 5 मिनट वेट करते हैं बाकी पार्टिसिपेंट का। और हम लेक्चर को स्टार्ट करते हैं। मेरी आवाज सभी को आ रही है? प्लीज चैट बॉक्स में बोलिए यस। आप सभी को मेरी आवाज आ रही है? ओके, हम लोग स्टार्ट करते हैं। सर्वप्रथम धन्वंतरी को नमन करके हम आज के लेक्चर को स्टार्ट करते हैं। आज के इस लेक्चर सीरीज में उपस्थित मेरे गुरुजन सभी वैद्यगणों को का मैं स्वागत करता हूं। आज के हमारे स्पीकर वैद्य पीएम मधु सर का मैं परिचय आप सभी को करा देता हूं। सर ने अपना ग्रेजुएशन VPSV आयुर्वेद कॉलेज कोट्टकल से किया है। सर ने अपना पोस्ट ग्रेजुएशन गवर्नमेंट आयुर्वेद कॉलेज कन्नूर से किया है। सर अभी गवर्नमेंट आयुर्वेद कॉलेज कन्नूर में प्रोफेसर है। सर को आज तक बहुत से अवार्ड्स मिले हैं। सर ने कंसल्टेशन इन आयुर्वेदिक डर्मेटोलॉजी, अ वर्किंग मॉडल इन डायग्नोसिस इन आयुर्वेदा, इन जैसे बहुत से बुक्स को सर ने लिखा है। बहुत से साइंटिफिक सेमिनार्स में सर ने अपने पेपर प्रेजेंटेशन किए हैं। तो मैं ज्यादा समय न गमाते हुए लेक्चर को हम स्टार्ट करते हैं और मैं सर से रिक्वेस्ट करूंगा कि सर प्लीज लेक्चर स्टार्ट।
Hello, can you hear me? Hello, hello, can you hear me? Hello.
यस सर, यस सर,
Okay, then can you see the slide?
यस सर।
Is it moving? Slide moving? Hello,
नो सर,
not moving?
not moving. Actually, introduction to Ayurvedic dermatology. We can see only first slide.
Now, moving.
Yes, sir. Now moving.
Okay. So, can you hear me properly? Any disturbance is there?
No, sir. No disturbance.
Okay. Okay. Thank you, Dr. Lilith, and all the doctors are welcome to my session. Actually, at the outset, let me convey my sincere regards to Dr. Lilith and Dr. Manju for inviting me, inviting our team to share some of my some of our views regarding Ayurvedic dermatology. We are practicing Ayurvedic dermatology, trichology, and cosmetology very successfully here in Kerala. So when Dr. Lilith and Dr. Manju contacted us for a session like this, actually, this session regarding Ayurvedic dermatology, trichology, and cosmetology, a triode of the a combination of the three subjects. Actually, whenever they contacted us, we have designed a particular module for this. We have designed that particular module so that all the clinical practitioners in Ayurveda can utilize this opportunity, can utilize this teachings or these learnings for their clinical practice, better clinical practice. Actually, in Ayurveda, as you know, we are getting so many dermatological cases. So our scientific treatment, our Ayurvedic treatment should be scientific and systematic. Scientific and systematic. We are having so many drugs. We are having so many treatments. We are having so many methods of application. So how we have to utilize all these medicines and all these therapies in a scientific and systematic way to practice this Ayurvedic dermatology. That is the key theme of our module. So once again, let me convey my sincere regards to Dr. Lilith and Dr. Manju, the all organizing team, for inviting us for to deal with this type of a subjects. Actually, let me uh, share some these kinds of cases. So let me show uh, some images as a basic, as an initial of this session. I think you also may be practicing, also may be seeing these types of cases. These are the common cases coming to our OPDs. Just to see the images, just to have a set induction, just to have a set induction, just I am showing these images. We got these cases within a period of 1 month. During the session, during the each and every session, we will be explaining each and every individual cases in detail. Okay. So these are some of our cases. Just to introduce that subject, I have shown these pictures. Actually, while we deal with the Ayurvedic dermatology, we cannot see a particular chapter detailing all the cutaneous manifestations in Ayurveda. Actually, in Ayurveda, we can see Kushta Prakarana is there, Visarpa Prakarana is there. Other than that, Shudra Kushta Prakaranas, Shudra Yoga Prakaranas are there. These are not the only chapters in which cutaneous manifestations are explained. We can see various types of cutaneous manifestations from the chapter of Jura to the chapter of Vadarekta. Various types of cutaneous manifestations are explained in detail in various prakaranas. While explaining Kabajajwara, there itself we can see some cutaneous manifestations like Udarda or Shidavitta, Sadhyo Vrana Prakarana, Agni Dagda Prakarana, Visha Prakarana, Dushi Visha, Abhigadaja Shobha, Vishaja Shobha, Udarda, Shidavitta, Visappa, Vidradi, Kushta, Uttana Vadarekta. In all these references, we can see at least some references regarding cutaneous manifestation. So, while we describe about cutaneous manifestations in Ayurveda, or while we discuss about Ayurvedic dermatology, we cannot confine our discussion only to a particular chapter. That is my point. Not only in Kushta, not only in Visarpa, not only in Vadarekta. We cannot confine our subject of Ayurvedic dermatology to a particular chapter. So detailed descriptions, discrete descriptions about cutaneous manifestations are there in different prakaranas. So what is the relevance of that discrete descriptions? See, in order to combine, in order to connect all the cutaneous manifestations, or otherwise we can tell, if you want to create a new subject like Ayurvedic dermatology, while you create a book on Ayurvedic dermatology, it becomes necessary to combine all these references from different prakaranas. I think you got my point. While you construct or while you frame a particular branch, Ayurvedic dermatology, it becomes necessary to combine all the principles and practices. That is the point. All the principles and practices. While you combine all the principles and practices, you can create a new subject called Ayurvedic dermatology. Among them, you can see trichology and cosmetology is there. Actually, cosmetology is a evolving branch of Ayurveda, not only the cosmetology, but trichology also. Actually, the patients or individuals are more concerned about their issues of hair, issues of their beauty. So many individuals are coming. They are not patients actually. Their individuals are coming to improve their beauty, to improve the texture of their hair. So the branch of trichology and cosmetology are the evolving branches. So we can um, we can have the scientific knowledge about the hair issues and cosmetological issues also, so that our clinical practices can be extended to that side also. Our clinical practice we can extend towards that side, trichology and cosmetology also. So while dealing with these subjects, these Ayurvedic dermatology, cosmetology and trichology, it becomes essential to combine all these branches, all these references from different parts of our classical textbooks. Charaka Samhita is the Susruta Samhita, Ashtanga, as you know, or well. From all these prakaranas, all these references, in this particular module, we are collecting various references from different textbooks, and we are ready to share that knowledge with you. In this particular course, we are trying to combine all these references, principles and practices, and we are ready to share that knowledge and practices. And we are practicing all these references here, and we are ready to share that knowledge with you in our course, in this particular course. So I am sure that the delegates or participants will be getting a thorough knowledge regarding Ayurvedic dermatology, trichology, and cosmetology. Previously also, we have conducted so many online courses like this in connection with this same organizers, and we are getting very, very excellent feedbacks from the delegates, doctors. They are practicing the same principles, and they are the same protocol treatments, and they are getting also, they are getting good results, and they are improving their clinical practices with this knowledge. So we are very, very happy that the organizers have already intimated all the details about the syllabus, and we are ready to share our knowledge regarding the theory and practice also. So as you know, the references, various references we will compile, and we will share that knowledge, and we will share all the slides also. And you see, our syllabus, as the organizers um, um, intimated you, our syllabus contains particular subjects starting from the clinical base. As you know, in order to know the clinical basis, it becomes necessary to know all the terminologies regarding the skin, anatomical and physiological peculiarities of the skin. So while describing the modern pathology, there will be so many terminologies regarding the pathological involvement, extension of pathology. So in order to know, in order to understand the pathological extension, it becomes necessary to know the anatomical and physiological aspects of skin. So initially, we will um, teach the, actually the term teach is not um, um, not proper for this session. Actually, all the delegates are doctors. It is not necessary to teach the basics, but we are sharing the details of the anatomical and physiological aspects, because just to refresh the idea regarding dermatology, just to refresh the idea. Actually, we will be, all the delegates or doctors are knowing the details of the anatomy and physiology. Still, we are trying to include that particular subject session in this particular module, because in order to enter into the pathology, in order to enter into the pathology, it becomes necessary to know the basic details of anatomy and physiology. So, Dr. Vandana will explain the anatomical details and physiological details of skin, so that it becomes very easy to enter into the pathological details of each and every disease. While describing the skin diseases, the terminologies, various terminologies will be there while describing the pathology. So, in order to understand the level of extension of pathology, it becomes necessary. So, initially, clinical anatomy and clinical physiology will be there. After that, we will explain the clinical examination of skin. Clinical examination of skin becomes essential or relevant, because how we have to start the history, how we have to collect the details of the patient, general history taking, specific history taking, how we have to take the history of patients with the cutaneous manifestation. As you know, there are so many materials coming in contact with the skin that can create allergy. So only by seeing the image, only by seeing the skin manifestation, we cannot diagnose the case, because there are so many related things in history. What are the materials in contact with that particular skin? What is the type of occupation he is doing? From where he is coming? Because the soil in contact or mud in contact or climate from which he is coming, or the hobby in which he is coming in contact with any hereditary matters, genetic issues. All these factors are relevant for diagnosing a case. Primary lesions are the like papular lesion, macular lesion, um, lichenification, and secondary lesions like scales are there. And the pattern of distribution of lesions in some particular diseases, by seeing only the pattern, we can diagnose the case. Only by hearing the history, we can reach at 100% diagnosis. So history becomes relevant. So how we have to examine the skin, how we have to collect the history of the patient. That is the integumentary system examination. Various types of eczemas are there. Various types of eczema. Actually, the nowadays patient coming to Ayurvedic dermatology OPD, they are having various types of eczema, starting from atopic dermatitis. Actually, atopic dermatitis is a condition in which the genetic involvement is there. If genetic involvement is there, then what should be our approach? What should be our approach to deal these types of cases? That genetic involvement is irreversible. We cannot reverse that particular condition completely. But what should be our approach to manage this case? That management is very important. So how we have to manage this case, type of cases? Before that, before managing, it becomes necessary to understand the classification of eczemas, how eczema becomes triggered, and what are the conditions in which eczema gets exacerbations, and what are the types of eczemas. Eczema lesions will be explained. Viral infection is there, bacterial infection is there, fungal infection is there. So infectious skin diseases. So only by seeing the external appearance, we can come into a diagnosis whether this is a fungal infection, whether this is a bacterial infection, whether this is a viral infection. So the particular morphological features of lesion, the pattern of spread, fate of that lesion, all will be explained in various types of infections. As you know, psoriasis, lichen planus, and pemphigus, these are very common diseases. Psoriasis is very common condition nowadays. So what are the types of psoriasis, classification, and how we have to diagnose the case? Biopsy reports, particular morphological features of psoriasis, and how the complications of psoriasis happens. Lichen planus. Lichen planus is a very uh, severe issue with severe itching. Severe itching will be there. Intense pruritus will be there. So how we can identify the case of lichen planus, how we can approach these types of cases will be explained. Pemphigus also. Pemphigus vulgaris is a threatening condition, threatening skin disease in which patient will be having bullous rashes over the skin. Bullous vesicular rashes or bullous rashes will be over the skin. Threatening condition. Modern medicine is managing the pemphigus with various kinds of strong steroids. Steroids. So what are the types of pemphigus vulgaris? What are the complications? How we have to approach these cases will be explained in pemphigus. And diseases of hair and glands. Actually, trichology means the diseases of hair. Okay? Diseases of hair. Related with that hair, glands are also there. So related with the hair and glands, what are the common complaints? What are the concerns and diseases? All will be explained in that session. And as you know, pediatric skin conditions are there. So many variety of pediatric skin conditions are there. So what are the common ailments related with the pediatric skin and how we have to manage? As you know, in Kerala, there is a particular uh, tradition related with the pediatric dermatology. Arogya Kalpadruma. Arogya Kalpadruma is a typical specific drug book in which the Balavisarpas are explained. Balavisarpa means pediatric skin disease. Pediatric skin disease, management of pediatric skin diseases are beautifully explained in Arogya Kalpadruma. So based on Arogya Kalpadruma, how we have to approach the pediatric skin cases. So pediatric skin diseases will be explained in that session. And also geriatric skin. As you know, the skin above 60 will be having so many degenerative changes. Due to that degenerative changes, patients will be having pruritus, itching. As a result of this itching, scratching, infections may be there. So management of geriatric skin also becomes necessary. So geriatric skin will be having reduced immunity, and due to the reduced immunity, various types of infections also may occur. So the approach towards the geriatric skin, management of geriatric skin will be explained. And as you know, pigmentary disorders, various types of vitiligo, leukoderma. Vitiligo cases and leukoderma cases are increasing because nowadays the nidana factors causing melanotoxicity. As you know, the melanotoxicity is a process of autoimmune reaction. As a result of autoimmune pathology in our body, antigen antibody reaction will be there. As a result of this antigen antibody reaction, there will be byproducts that destroys the melanocytes. They are known as melanotoxins. So as a result of this melanotoxicity, melanin destruction happens and vitiligo or this leukoderma happens. Pigmentary disorders will be there. Shutra. In Shutra cases, what are the issues related with that particular pathology? How that happens and how we have to deal these cases? All will be explained in these pigmentary disorders. Then obviously psychodermatology. That is an evolving branch of science, psychodermatology. Actually, the relation between the skin and mind. As you know, the skin diseases can be aggravated due to stress factors. Also, patients have stress due to skin diseases. So these are interconnected things. Skin patients may have stress, and the cutaneous manifestation can increase due to stress. So how we have to understand the connection between mind and skin, and what should be our approach in these cases? That will be beautifully explained in that particular session called psychodermatology. And as you know, whenever you see a cutaneous manifestation, we have to rule out some primary health issues in that particular patient. For example, in a patient with intense pruritus, as you know, there will be some case discussion sessions in the previous month, April month. There was a patient with intense pruritus all over the body. He was presented with itching all over the body. As a general rule, we have to rule out primary illnesses, primary clinical conditions hidden inside the body. So for that, we have to do some investigations. Whenever we send that patient for laboratory investigations, for LFT, liver function test. So actually, that particular patient was having the obstructive jaundice. Obstructive jaundice can result in this pruritus, itching all over the body. So, as a result of some systemic illnesses, patient may have cutaneous manifestation. So, in this particular session, cutaneous manifestation in systemic diseases. What are all the cutaneous manifestations in which we have to suspect some systemic illnesses will be explained in so many systemic illnesses. For example, thyroid issues. For example, diabetes. For example, in kidney diseases. For example, in liver diseases, we may have some cutaneous manifestation. So we have to understand the inner pathology in which cutaneous manifestations may be there. So in that session, that particular matters will be discussed. So as I told, investigations in dermatology, that subject also very relevant because in certain dermatological or cutaneous manifestations, we have to do certain investigations. How we have to approach these cases with the laboratory investigations? What are the findings? What are the findings? What may be the findings in these cases will be explained in that particular session. And skin diseases in Ayurveda basis. See, whatever may be the terminology, whatever may be the skin disease, whether that is a psoriasis, whether that is a lichen planus, whether that is a molluscum contagiosum, whether that is a pemphigus vulgaris, the treatment should be based on the principles of Ayurveda. Treatment should be based on the principles of Ayurveda. So, we have to frame our own principles regarding skin diseases. See, as per the principle of Ayurveda, psoriasis for four psoriasis patients, four patients are there. Our treatment will not be same for these four patients. See, we are adopting individualistic and holistic approach. Individualistic and holistic approach. How we have to consider all these cases and how we have to approach with the Ayurvedic profile. Skin diseases, how we have to connect the theory and practice. As you know, we are having so many basic principles. How we have to connect these basic principles with our practice. We are practicing Ayurvedic dermatology with the basic principles. How we have to utilize these principles in providing systematic and scientific treatments to all these patients. Nidana Samprapti. The concept of Nidana Samprapti will be elaborately described in that section. Without the concept of Nidana Samprapti, our treatment should be, whatever we provide, they are not scientific. Whatever we provide to patients, whatever we advise to patients, without knowing Nidana Samprapti, our knowledge is not a scientific knowledge. So, how we have to connect the basic principles of Ayurveda with our practice will be explained in that session. And the rationale behind the selection. The rationale behind the selection of each and every drug. As you know, we are having so many drugs. In Kerala also, Kerala practice, we are utilizing so many drugs, so many herbs. Uluchadi Kashaya, Nimbadi Kashaya, Padoladi Kashaya, Manjishtadi Kashaya, Mahamanjishtadi Kashaya, Primignavadi, Rajanyadi, Avibhatti. All the medicines are there. We are having Kalyana Grida, Mahadikta Grida, Vajra Grida. These types of Gridas are there, Aristas are there, the Kashayas there, the Churnas are there, tablets are there. What is the rationale behind the selection? So, how we have to utilize or how we have to select these medicines scientifically and systematically. That is the key behind this particular course. In this course, after completing this course, every delegates will be having a knowledge regarding the scientific details of selection. Protocol. What is the protocol to select Puluchari? What is the protocol to select Nimbadish? What is the protocol? Wherever we have to select these particular medicines. That will be explained in the very, very detail. And as you know, parallel to systemic therapy, we are utilizing so many topical or external treatments. Different types of kashayas are there for washing. Different types of bandages, occlusive bandage and the compressive bandages. Various types of bandages are there practicing in Ayurvedic dermatology. All will be demonstrated with the videos. With the essential videos, we will show all the details of topical therapies, dhara, rektamoksha. Rektamoksha in another session, rektamoksha in skin disease in another session. Prachana, Siravedha, Kuttana, and this Jaluga Vajarna. All these procedures we will detail with the videos. And Pathyapatyas. See, while we prescribe medicines, if we are not addressing the Pathyapatyas, in skin diseases, the aharas are very, very relevant. Whenever you address a particular medicine, along with that medicine, in order to support that medicine, we have to advise about the do's and don't do's in food habits. They are very important. So there is a particular session on Pathyapatyas. And along with these particular sessions, there will be special case discussions. What was the presentation and what approach and what we have given, what are the medicines we have given, and in follow-up, what was the result. Nearly 20 cases will be discussed in that session. And another session, skin allergy. Allergy is a very, very common and general case nowadays. So particularly dedicated to skin allergy, there will be a particular session for case discussion. And there will be 2 sessions regarding Rasaushadis by Dr. Jitesh. And the modern parts like eczema, psoriasis, lichen planus, all will be discussed by Dr. Abdul Rao. Abdul Rao sir is a professor at Thrissur Medical Ayurvedic College, and he will be discussing the modern parts, Ayurvedic parts, and I will be discussing the Ayurvedic parts, how we have to approach in Ayurvedic way all these conditions. And Rasaushadhas in dermatology will be discussed by Dr. Jitesh sir. He is a senior physician at Topical Ayurveda, his famous institution. And along with that, Dr. Vidya will be discussing the cosmetological practices. Various types of cosmetological practices are there. Specific medicines are there. Specific procedures are there. And cosmetological practice will be discussed by Dr. Vidya. And trichology, basics of trichology and the basics of cosmetology will be there. And trichological practices, what we are doing, what we are practicing here, all will be discussed in a detailed manner. And Kesha Ayurveda in practice. What are the practices? In Kesha Ayurveda also will be discussed in that particular session. And along with each day's session, there will be question answer session. Each day, after completing the session of 1 hour, there will be question answer session. In that question answer session, you can ask what are the questions, and we will collect all these sessions. In that session itself, we will try to answer. And if we are not in a position to answer that particular query, we will be answering that particular question at the end of the session also. And during this whole month of the sessions, you can raise your own queries and collect. We will collect all these queries in detail. We will collect all these queries. Along with that, we will provide some PDF regarding the Ayurvedic dermatology practice. Dermatological anatomy and physiology PDF will be there, and the dermatology atlas will be there. PDF we will share, and some PDF of some books also we will share. Some dermatology books are there. We will share that, and at the end of the session, particularly dedicated for question answer session, you can ask whatever your queries you have. So we will try to answer all the queries we are practicing, and I think this 1 month's course will be very really enriching your clinical knowledge, and that will be a real boon for your clinical practice, and that will provide a, uh, a real input, for your clinical practice in Ayurvedic dermatology. And let me conclude here this session. So best wishes for you all delegates, and I think all delegates or doctors will be in a position to gather the grasp the knowledge regarding Ayurvedic dermatology. And during this course, during a period of 1 month, we can discuss various matters regarding Ayurvedic dermatology. As you know, we are practicing the Ayurvedic dermatology in Kerala practice. We will share our knowledge, and we expect your own traditional practices. You can share that also. You can share that practice. That will be really enrich us also, because we can also utilize your practice, the practical knowledge also. So during this period of 1 month, we can discuss, share. We can we can be good friends, and thank you all for hearing this much time, and thank you very much for organizing this session, Dr. Lalit and Dr. Manchu. And let me conclude here, and I think from June 3rd onwards, we can start this session, and that session will be very excellent sessions, and you can provide your own inputs also. So if you're having any doubts regarding this particular session, today's session, you may ask, and I will try. Otherwise, you can ask your queries regarding the skin diseases and practices in coming sessions. Okay, thank you very much. Anyone from organizer side? Hello, anyone
Hello,
from
sir.
organizer? Yeah. Anyone?
Hello, sir.
Yeah.
Namaste, sir.
Namaste.
One female patient having scabies from 6 to 7 months, and it is not curable. She has taken homeopathic, Ayurvedic, and uh, allopathy also, but it is not getting relief completely. Hello.
I'm not sure about you actually that kind of cases will be there in the. I will explain during the session of the dermatology, Ayurvedic dermatology. During the session also I will explain. But actually, you have to collect the images and history. While discussing the cases, you should remain that while discussing the cases, along with the images of the cases, you should collect the history also. Along with the images, while sending the pictures to me, to our group for discussion, you have to collect the history. A proper sheet should be there. That case sheet we will share during the session, the discussion, or during the session, during the clinical examination also. We will share some case sheets. You should collect the cases according to the case sheet format. According to case sheet format, and you should share the images along with the format. Then only we can assess the case properly, and we can identify the case, and we can frame a treatment for protocol for them.
Okay, sir.
Okay. We will explain all the skin cases and treatment protocols, approaches. All will we will explain.
Okay.
Hello, sir.
Yeah.
So course is starting from 3rd June, right?
Yeah.
So what are the timings for daily lectures?
That all the details of the courses will be intimated you in
Okay.
detail. Detail.
Okay, fine.
Sir, actually some questions
Hello,
are
sir.
in chat box.
You may read them. I'm not in a position to read that.
Okay.
Hello,
Will you,
sir.
madam, ask.
Sir, recording will be provided of every lecture.
हाँ, रिकॉर्डिंग्स अवेलेबल रहेगी जनरली 24 आवर्स टू 48 आवर्स में रिकॉर्डिंग मिल जाती है जो ऐप पर अवेलेबल रहती है.
अच्छा सर, इसके अलावा जैसे सर ट्रीटमेंट भी प्रोवाइड किया जाएगा पीडीएफ में अकॉर्डिंग टू द डिजीज.
According to
Actually,
we will share the slides.
एक्चुअली मैडम सर ने जो अभी लेक्चर में कहा है कि हमें निम्बादी चूर्ण कहाँ यूज करना है, अकॉर्डिंग टू कंडीशन पूरी कंसेप्ट्स आपको स्पेशल लेक्चर में ट्रीटमेंट के रिगार्डिंग पूरी समझाई जाएगी ताकि आपको ट्रीटमेंट करने में कोई दिक्कत नहीं रहेगी और ड्रग सिलेक्शन में कोई प्रॉब्लम नहीं रहेगा.
अच्छा, मतलब सर डिजीज वाइज आप ट्रीटमेंट प्रोवाइड नहीं करेंगे, हमको ही वो सब समझकर सीख कर प्रोवाइड करना.
Please understand that actually, as per Ayurvedic principles, for every psoriasis patients, particular churna cannot be utilized. So how we have to approach, what should be our approach, and how we have to utilize the particular medicine scientifically, that will be explained in a detailed manner. And after completing that session, you will be in a position to prescribe a medicine in that particular case. That is the idea.
ओके, थैंक यू सर.
डेली लेक्चर्स नहीं रहेंगे, हफ्ते में 5 दिन लेक्चर्स रहेंगे. रिकॉर्डिंग विल बी अवेलेबल.
सर लेकिन उनका टाइमिंग क्या रहेगा? लाइव लेक्चर्स रहेंगे, राइट?
हाँ.
या फिर रिकॉर्डेड रहेंगे वो?
नहीं, लाइव क्लासेस रहेंगे. टाइम 8 to 9:30.
इधर रखो, दादी के पास रख लो. मारा.
हेलो.
फीस स्ट्रक्चर फॉर फर्स्ट 50 पार्टिसिपेंट 4,000.
सर लेकिन अगर हमें टेंटेटिव टाइम अगर पता चलता ना कि इस टाइम पे लेक्चर्स
8 से 9:30 के बीच में लेक्चर रहेंगे.
ओके, क्योंकि हमारा शेड्यूल अगर एडजस्ट होता है तो उसके हिसाब से. ओके, थैंक यू सो मच सर.
यस अंजलि मैडम, एवरी डिसीज आयुर्वेदा के हिसाब से एक्सप्लेनेशन रहेगा. अगर किसी को कुछ डाउट है तो प्लीज खुद को अनम्यूट करके आप क्वेश्चंस पूछ सकते हैं।
हेलो सर। हेलो सर।
Yeah.
सर मैं अभी का वो वेबिनार में अटेंड नहीं कर पाई, वो फुल हो गया था इसलिए। तो मुझे कोर्स के बारे में फिर से रिपीट जानकारी दे सकते हैं?
हाँ मैडम, मैंने नंबर डाला है चैट बॉक्स में मेरा, प्लीज मुझे मैसेज कर दीजिए। और आज के लेक्चर के रिकॉर्डिंग्स भी कल हम ग्रुप में शेयर करेंगे।
ओके, थैंक यू वेरी मच।
हेलो हेलो हेलो।
Yeah. Yeah.
हाँ बोलिए बोलिए।
हाँ सर, रक्त मोशन वगैरह जो है ना, वो हमें लाइव मिलेगा देखने के लिए?
Pardon, lecture
हेलो।
motion?
हाँ सर, रक्त मोशन का भी जब भी लेक्चर होगा ना सर, तब
Yeah.
हमें वो लाइव देखने मिलेगा क्या, या रिकॉर्डिंग भी चलेगा?
I demonstrate. I show the videos. Live video. I will share the video.
ओके सर। और सर मेडिसिन प्रिपरेशन या कुछ करना है तो वो भी सर इंक्लूड होगा क्या इसमें? अगर एनी काढ़ा है या कुछ भी है, अरिष्ट है या कुछ?
Medicine preparation is not mentioned. That the medicines. What are the medicines can be what which can be utilized? That medicines I will tell. Preparation I will not tell.
ओके, थैंक यू सर।
So I think Dr. Lalit, the questions will not be there because after starting the session, there will be queries. They can write down the queries and they can ask the questions very freely. We or faculties will be in a position to answer these queries. If the at the end of the session, each session, the faculty will answer your queries. There will not be any doubts regarding the session at the end of the session. So let us conclude here. Thank you.
Yes sir. Yes sir. Okay. Thanks all. Thanks sir.